When we think about turning back the clock on aging, we usually think about creams or maybe some minor procedures. But today, we're diving deep into a recent scientific paper that outlines something pretty radical, a new surgical approach to facial rejuvenation that's not only more effective, but might just be nearly scarless. So let's just start with this question, because it's at the heart of everything we're about to talk about. For years, the go-to facelift technique has been about pulling things, well, sideways. But what if there's a smarter way? What if you could work with the body's structure, not fight against it, to get a result that looks more natural?
Now, before we can really appreciate the solution, we have to get on the same page about the problem. And it turns out the way most of us picture facial aging is, to put it simply, just scratching the surface.
Yeah, we see wrinkles, we see sagging skin, and we think, okay, that's it, that's aging. But the research is really clear on this. What we're seeing on the outside is just the final clue, the end result of some much, much deeper structural changes happening underneath.
You know, you can think of your face as having layers, kind of like the geology of a canyon. You've got bone, you've got this deep structural tissue called the SMAS, you've got fat pads, and then finally the skin on top. And with time, it's not just the skin that droops. All of it, every single layer, starts heading south together.
And don't just take my word for it. This quote from the study nails it. Everything is moving down as a single unit, as a composite. And that's the key insight here. Because if everything is sliding down, does it really make sense to just pull it sideways? Probably not, right? And of course, science has a name for this. It's called the pitose vector. You can basically think of it as the villain in our story. It's this invisible arrow that's always pointing down and a little bit inward on the face. It's the natural path of aging, and any real rejuvenation has to fight that vector head on. Okay, so if the problem is gravity pulling everything down, the most logical solution has to be a direct lift straight up. And this brings us right to the innovative new technique from this study, one that promises to do exactly that, all while hiding the evidence. And this chart just lays it out perfectly. On the left, you've got your traditional facelift. See that incision right in front of the ear? That's the classic telltale sign, and it's designed for a sideways pull. But now look at the right. This is the new technique, the TDPF. The incision? It's gone. It's hidden up in the hairline. And the lift? It's a true vertical vector, the exact opposite of that ptosis vector we were just talking about. So what are surgeons actually lifting to get these results? It's this all-important layer, the SMAS. The easiest way to think about it is like the structural frame of your house. You can repaint the siding. That's like a skin-only lift, but it's a temporary fix. If you want a real, lasting change, you have to lift the actual frame. Lifting the SMAS repositions the entire structure for a result that's not only powerful, but lasts. Okay, so how in the world do they do it? How do they get to that deep layer and lift it vertically, all through a tiny little incision hidden in your hair? It sounds kind of like magic, I know, but it's actually just a brilliant mix of deep anatomical knowledge and some very cool modern tech.
So it breaks down into 4 main steps. It starts with that small hidden incision in the temple. Then, and this is the high-tech part, an endoscope, which is just a tiny camera on a thin tube, goes in. This lets the surgeon see everything perfectly without having to make a huge cut. From there, they can safely get down to that deep SMAS layer, release it, and then lift that whole composite structure straight up, securing it in a higher, more youthful position.
Now, all of this sounds fantastic in theory, but the big question is always, does it actually work in the real world? And what about the risks? Well, that's what the clinical study was for, to put this technique to the test. And this wasn't just a weekend project. The study itself ran for over 3 years, from the beginning of 2020 right into 2023. And what's really important is that they followed up with patients for up to 3 years after the surgery to see how the results held up over time. And we're not talking about a handful of cases here. The study looked back at 140 patients. A number that big gives the results some real weight. It's enough data for us to feel confident about how effective and, just as importantly, how safe this new procedure really is. Okay, I think this is fascinating. The surgeons needed a totally objective way to prove a vertical lift happened. So what did they do? They measured the distance from the lower eyelash line down to the cheek. As the face sags, that distance gets longer. After the procedure, that length was reduced by an average of over 22%. That's not just someone saying it looks better. That's a hard, measurable, significant structural lift. Of course, no surgery is ever 100% risk-free. So what did the numbers show? Honestly, they're pretty impressive. The complication rate was really low. Only 5 patients had a temporary nerve issue, and it went away completely on its own within 3 months. Just 6 people needed a minor revision. For a deep, complex surgery like this, those figures suggest a really strong safety profile.
So, after looking at the theory, the technique, and the data, what's the big takeaway? What does all this mean for the future of fighting gravity? Let's break down the final verdict.
The conclusions here are pretty powerful. This technique actually delivers on that promise of a true vertical lift. It rejuvenates the whole midface, the eye area, those smile lines, the jowls. But the real game changer is how it does it, with a potentially quicker surgery and, most importantly, without that visible scar in front of the ear. I mean, that alone is huge. And that really brings us to our final thought. What we're seeing here is a technique that combines a smarter understanding of anatomy with modern technology to create a huge result with minimal evidence. It really makes you wonder, doesn't it? As these kinds of techniques get more and more refined, are we heading for a future where the best facelift is one you can't see at all?